Good afternoon, everyone. Welcome to Social Security Part 2, SSDI Work Incentives and Dual Beneficiaries. This is a collaboration between the Florida Center for Inclusive Communities, also known as FCIC, and the Florida Association of People Supporting Employment First, also known as FLAPC. It's the only national membership organization to focus exclusively on inclusive employment and career advancement opportunities for individuals with disabilities. We thank you for being here today. And I am the FCIC Employment Coordinator. I am also the FCIC Community Liaison. And also I'm a consultant for the Center for Autism and Related Disabilities at USF. We have three presenters today, and they will introduce themselves throughout their presentation. We have Bill Bloxham, we have Maddie Weiserick, and we also have Michelle Wells. And I will put the links to the PowerPoint into the chat. You should be able to view it and download it. The RTF is just a Word document that we saved as a PDF. And then the PDF is actually the slides that have been saved as a handout. And so our presenters, you can take it away.
Denise, you mentioned a video. Are we going to play that after?
I thought I was sharing, but I see that I was not sharing. So I'll play it afterwards.
Okay, sounds great. I'll go ahead and share my screen. Okay. Can I get a thumbs up or maybe this is sharing? All right, great. Wonderful. Welcome, everyone. We really appreciate you being here today. Hopefully, some of us were here last week, and if not, we do have a quick refresher. But we are going to be going over SSDI, which is Social Security Disability Insurance, work incentives for that program, and talking about dual beneficiaries. And thank you for joining us today. So the agenda for today, we're going to go through some introductions. My name is Maddie. We have two other presenters today, so we'll talk about who we are and why we're presenting. We'll talk about SSDI, work incentives, dual beneficiaries. We'll go over any questions, have a Q&A session, because I think that's an incredibly important part of learning about this is questions that you might have, so we can hopefully answer those for you, and resources that we'll share. Sorry, I just saw the chat there. The goal for today and last week is to increase our general understanding of benefits, eligibility, work incentives, and how working impacts those benefits and potentially healthcare coverage. Okay, since I'm talking right now, I'll go ahead and introduce myself and then pass it over. My name is Maddie Weisorick. I am a benefits planner with Next Step Success, providing services right now in Virginia. I am a person with a disability. I also have been a recipient of benefits. I've worked with VR as a provider and also a client on and off over the years. And I'm really excited to be able to talk about these things with you today. I'll pass it over to Michelle.
Great. Good afternoon, and hopefully you guys have some good lunch on hand. My name is Michelle Wells. I'm a Senior Work Incentives Specialist for the Grow Group, Inc. out of Tampa, Florida. But I am a District Director for the vocational program in the Commonwealth of Virginia. And I've been with the Grow Group for about 6 years and with the Commonwealth of Virginia for about 25 years.
And my name is Robert Bloxham. I am the president of Benefits Consulting Services. Like Maddie, I am also a person with a disability. I have cerebral palsy and use a wheelchair, and also have been a client of VR and now a vendor as well.
All right. Thank you. All right, like I mentioned, I wanted to start with a quick refresher in case some individuals weren't here last week, because we're talking about two different programs that often are called the same thing, Social Security benefits. So last week we covered SSI, which is a Supplemental Security Income Program. This program is based on needs and income, assets or resources, and living arrangements. So this is a needs-based program for individuals, and that benefit will change based on how much you're working. It's an exact science. There's a calculation sheet. When you put in whether earned income or unearned income, it will change that benefit amount. And there is a resource limit, like I mentioned. So for an individual, it's $2,000. For a couple, it's $3,000. In 2025, right now, the federal benefit rate is $967 per month for an individual. And the healthcare coverage that goes along with SSI is Medicaid. So you'll hear those things tied together quite often. What is SSDI? So this is Social Security Disability Insurance. So you can already hear the difference between income and insurance. This is an insurance policy that is based off of a work record. It might be your own work record or a work record of a parent or a spouse. It's a monthly amount that you're getting based off of that work history. You pay into this trust fund, and if you happen to become disabled before retirement, then you are able to access these these disability funds. And just like Medicaid is with SSI, Medicare goes along with SSDI. And there's a 2-year waiting period typically for most individuals after they are approved for disability and those payments begin. I am a visual person. I like seeing things in charts and diagrams. And so I wanted to help us kind of be able to see the differences on one slide between SSI and SSDI. So on this slide, you can see that in the darker yellow is SSI. And like I just mentioned, needs-based program, monthly benefit can change based on other income or support. For example, if someone is getting in-kind support like shelter or food, that can change how much that benefit is. Typically, individuals have little or no work history, and they have limited income and resources. And like I said before, Medicaid goes with that SSI. SSDI is that insurance-based program. Oh, sorry, I gotta stop seeing these chats here. I apologize, I just saw that there. But insurance program based on work history, and the benefit amount is based off of prior earnings. So like I mentioned, we pay into this when we pay our taxes, and when you have enough work credits, then that is when you are qualified for this SSDI program. There's no resource limit with SSDI, and it comes along with a series of work protections. Like I mentioned, Medicare is the health insurance policy that goes with that. And then in the middle, there's the dual beneficiaries or concurrent, which we're going to talk about today as well. But they are individuals that receive both benefits, both SSI and SSDI. And it is usually when that SSDI benefit is low enough for the individual to still qualify for SSI. And Michelle is going to give us some more details about that later with the calculation sheet. All right, Michelle.
All right. Thank you, Maddie. I appreciate it. That's why I don't turn my camera on, because I get distracted. So, so my camera will be off for now because I'm going to deliver quite a bit of information for you. But there are 3 types of Title II benefits. Okay, so there's 3 things that individuals possibly could get, and they all apply differently. So for the one thing that we were talking about initially was the Social Security Disability Insurance. It is a federal program that provides monthly payments to people with medical conditions that prevents them from working. The benefit is funded by a portion of the Social Security taxes paid by workers and their employers. The eligibility criteria: to be eligible for SSDI, you must meet both a work history and a medical disability requirement. Work history: you must have worked and paid Social Security tax for a sufficient number of years to be considered insured. The number of work credits, right now it's 40 work credits, is needed to be qualified depending on the age when the disability begins. Generally, older workers need more credits than younger workers. Number 2 is the Childhood Disability Benefits, or CDB. This is a type of a Social Security benefit paid to an adult who has a disability that before it happened age 22. This person receives benefits based on a parent's Social Security earnings record, not their own. The program is sometimes also called Disabled Adult Child, or DAC benefits. To be eligible, For a CDB, an applicant must meet the following criteria. Disabled before age 22. The individual must have become disabled before their 22nd birthday. They're unmarried. The adult child must be unmarried, and some exemptions for marriage to another Social Security beneficiary. Age 18 or older. The applicant must be at least 18 years old. Apparent Social Security status. The applicant's parent must be either receiving Social Security requirement or disabled benefits or deceased and had worked long enough to be insured for Social Security benefits. Meets adult disability criteria. The adult child must meet the Social Security Administration definition of disabled for adults, meaning they cannot engage in gainful activities, substantial gainful activities. And the last one is survivors benefits, sometimes called the disabled widowers benefits, which is DWB. And again, this is a type of Social Security payment for surviving spouses who have qualified disabilities. These benefits are paid based on the deceased spouse's earning records. Eligibility requirement. To be qualified for DWB, you must meet the following criteria. Age. You must be between the age of 50 and 60. Deceased spouse's work records. Your deceased spouse must have worked long enough and paid sufficient Social Security taxes to be earned to get those work credit survivor benefits. Disability. Your disability must meet the Social Security Administration's strict definition. It must be started within 7 years of your spouse's death. Marriage. Generally, you must have been married to that deceased person for at least 9 months before they died. And then remarrying before age 50 would generally end in your eligibility for DWB. Other benefits. Your DWB benefits or payments will be reduced if you are also receiving other Social Security benefits. If you're eligible for the highest benefit on your own work credits, you would not receive DWB.
So the SSDI work incentive, some of the safety nets and some of the protections that people on SSDI get when they start their working is phase 1 is the trial work period or the TWP. So any month where earnings are more than $1,160 counts as a trial work period month, but you can make as much as you want during that time or above SGA. We prefer to say above SGA because then after the 9-month trial work period, you still have to be able to get below SGA after that. So after your 9-month trial work period, you enter the extended period of eligibility, and that continues for the next 36 months after your trial work period ends. So, and that's whether or not you continue to work or not. So it's just a 36-month continuous clock. And for 2025, SGA is $1,620 a month. So you want to keep your countable income below that 1620 in order to make sure that you still receive your Social Security check. If you go above that number, your check can be stopped. So, and then after you finish your 3 years of extended period of eligibility, you enter expedited reinstatement. So basically, you can continue to work as long as you're under that SGA limit, and you can request reinstatement if you go over that without filing a new application. So, and you can still keep your Medicare benefits during all this time as well. So, and if you file for expedited reinstatement, you do not have to file a new application. So you don't have to start all over again. You can just say, hey, I'm back under SGA at this point. Can you please restart my benefits? And then you'll go through that process, and it's a lot faster than filing a new application.
All right, if you were with us last week on Friday, I talked about impairment-related work expenses. How this is different, and I'm going to go through it again if you have not joined us last week. Impairment-related work expenses is a work incentive, it's for an out-of-pocket cost for products or services that is necessary for a person with a disability to work. The Social Security Administration allows beneficiaries of SSDI to deduct their expenses from their earnings. Their reductions, they're called countable income, which helps them maintain eligibility for benefits while working. Conditions of the IRWE. For an expense to be approved as an IRWE by Social Security, it must meet several criteria. First of all, it is needed because of a physical or mental impairment. It is required for a person to be able to work. It is paid for by the person and not reimbursed by another resource or sources such as insurance. The cost is considered reasonable, reflecting the standard charge for the item of service in the person's community. Let me give you some examples of some IRWEs. Medical costs, prescription medication, medical devices like wheelchairs, respirators, braces, and certain medical services such as doctor's visits and therapies. Transportation, specialized transportation services, vehicle modifications, and attendant care needed for commuting to and from work. Assistive services, costs for attendants, readers, or interpreters that enable a person to perform their job. Work-related equipment, assistive technology, adaptive equipment, and services specified required due to the impairment. Residential modifications, altering the home, such as a wheelchair ramp or modification to the home office, if that is necessary for working. Your service animals, the costs associated with caring and inquiring for the service animal and assisting with job functions. How IRWEs affect the benefits. So for SSDI recipients, the cost of the approved IRWE is deducted from the gross earnings to determine if your work activity is above substantial gainful activity level. This can be critical for maintaining your SSDI benefits. To claim an IRWE, again, work with your Social Security offices. You must submit proof of payment, such as receipts, to your Social Security Administration. You should also provide a clear explanation of how the expense is related to your disability and necessary for you to work. Next slide.
So this is Medicare. So Medicare, like we talked about before, comes after a 2-year waiting period, and you automatically get hospital insurance, which is Part B, and the medical insurance is optional, and there is that is the Part B, and there is like Medicare savings programs and other options, Medicare supplements that will help with the cost of that premium. And the Medicare Advantage Plan Part C is some of those managed care. So like an outside insurance company that kind of fills in the gap, or like a donut hole coverage. And you can also get Part D prescription drug plans. You guys probably see those advertised everywhere. Again, also through outside insurance agencies. And we talked about that extended Medicare eligibility. You have 93 months counting your extended period of eligibility to even after you get off of benefits. So you don't necessarily have to worry about medical insurance after you choose to get off of benefits for income reasons or for other things. So that is a pretty substantial work incentive because you can really help with your medical costs and not have to worry so much about how am I going to pay for this.
All right, so you can get both. I'm not sure if people knew that they could get SSI and SSDI. It can come in many different ways through those Title IIs that we were talking about. I would say probably I've been doing this for about 6 years, and I would say, I don't know, Bob and Maddie, what, 10 to 15% of our folks are probably duals? Do you think that's accurate?
That's exactly
sounds
what I was
right.
going to say. Yeah.
Yep.
Yes, so it does happen, and it happens often enough where making sure the right guidance is provided is so key to their success, because this is a very unique group. So go to the next slide and we'll talk about the SSI calculation sheet. All right. So what I'm going to do is I'm going to talk about James today. James is a dual beneficiary. He's 38 years old. He's receiving SSI and SSDI. He has Medicaid and Medicare. He wants to work part-time, doing office work. He's entitled to his SSDI as a disabled worker, and he's receiving $670 a month for that. As an SSI recipient, later on, he is now receiving $317 in his SSI check. So why we put up this calculation sheet is when we do our benefits reports for individuals, they're being on both sides of things. They have the SSI obligations and the SSDI, and the rules apply in both different ways. So the initial steps are the SSI calculation sheet. The unearned income is where that earnings for the SSDI amount goes. And as you can see, it starts at the very top. So if you were curious about last week, hey, what about that top part? That's what happens there. That's where that $670 goes. Okay. So I'm going to put James in a situation where he may be earning gross earnings for a month, $1,000, maybe $1,125.80, let's say, and I'm just going to run through it with you. So situation is unearned income is where his SSDI amount goes. Okay, so that 670 goes there, and then immediately minus 20. Okay, and then it comes up at 650 as the unearned income. Okay, so if you scroll down, you're trying to figure out, where does that go in this calculation sheet when we finally get through his earnings? If we get through that 1,125 and we finally get down to a total countable earned income, right? So what happens is you take that countable unearned income and that countable earned income, and you put it together. So this will show you rather quickly, the person is probably going to have a larger amount of countable income, and he's probably going to likely go to zero with his SSI payment. Does he lose his SSI? No. Will he go to zero? Yes. But then we have to now go on to the SSDI side of things and show him that he's not going to be really getting involved with any of his protections, right? So you can go to zero and still maintain both of your insurances, and you can continue on with your SSDI payment. But ultimately, when it's all done, he will be making more money for himself working rather than not working. So again, that unearned income on your calculation sheet is usually that SSDI amount that you want to put there. I know it can be confusing, but Hopefully that makes a little bit more sense. So when we do the reports, we want to show both sides of things. Individuals are likely to go to zero if they're not getting a lot in their SSI check. It's that SSDI protection is probably going to sustain more than their SSI. Next slide.
So for self-employment, pros and cons. Self-employment with disability is a little tough and a little challenging. Is you get your flexibility. You can be your own boss. You can do what you want. You can do it whenever you want. And there is work incentives like IRWIs that we talked about before, and Social Security counts your net earnings from self-employment, so your earnings minus your expenses. So an unpaid help, like if your parents were an accountant and they kind of help you with your books and you are not paying them, but they're helping you, and the service they provide is $500 worth of services, you can claim that $500 as an IRWI expense, and also unincurred business expenses. Maybe you got a grant to buy a certain piece of equipment or things like that, and you can still write off the cost of that equipment even though you didn't necessarily pay for it. I will say it is a lot of record keeping. I would not advise doing this yourself. I would look into getting with VR, working with a benefits planner or someone that is very experienced, small business association, in helping folks with self-employment, because you do have to be very organized and keep very great records. So, but the cool thing with it is you can customize the employment to fit however works best for you. So obviously being your own boss, you know, if you have doctor's appointments that are Tuesday and Thursday, maybe you only work Monday, Wednesday, Friday, or, you know, something along that line, and you can choose what you want to do and what you don't. And as technology changes, as more and more people are working from home, more and more disabled folks are choosing to go into business for themselves. And so it's not impossible to do, but you definitely have some help when you're doing it, because it does get very complicated. Next slide.
All right. Thanks, Bob. I appreciate you sharing your thoughts on self-employment. That's great. Okay. I'm going to jump into reporting wages. And I talked about how important last week for SSI to report your wages on a regular basis. I mentioned that Social Security prefers that an individual report by the 6th of the following month. So, for example, right now is October. And so if an individual works this month, making sure by November 6th they report those wages to Social Security. There are various options to report: mail, fax, dropping it off in the office. There's a website to be able to do that. There's an app for some individuals. Any of those options, the reason there are so many is because different things work for different people. So as long as you find a way to report those wages, that's the really important piece, is making sure that you do that. Or maybe you're a job coach and you're going to help that individual learn how to do that. As a benefits planner myself, I would be more than willing to help that individual figure out what works best for them. I do want to put this disclaimer here because we are experiencing a government shutdown right now, and I have heard that many people are reporting to us a challenging time reporting their wages, or the inability to report their wages right now. So we want to just recommend that those individuals create their own sort of tracking system. It can be digital. It could be a file of all those pay stubs. It could be paper. It could be, you know, something they keep all of those until they want to drop them off, or drop off copies of those. But we just want to make sure that people are keeping their receipts and their pay stubs. And if they are reporting wages, Social Security should give some sort of receipt proving that those wages were reported. The most important reminder on this slide specific to dual beneficiaries is if an individual has SSI and Title II, they need to report to both programs. It sounds kind of silly because for me, if I walked into the Social Security office and I had one of these benefits, I would report my wages and say, okay, I'm good. And then for someone that has both benefits, they would probably do the same thing, go to Social Security, report their wages and say, I'm good. You would think that the Social Security Administration would let them know, hey, you have two programs and we need to report to both. But unless that person says I need to report to both programs, those wages may not get reported on both sides. So that's the important reminder, is help those individuals to report to both, or if you are a dual beneficiary yourself, make sure that you report to both of those. All right. We wanted to make sure to also talk about overpayments, because that's a big part of having benefits, unfortunately, is that often individuals will experience at some point in their time being a beneficiary that they're going to have an overpayment. The reason an overpayment can happen is if Social Security pays a beneficiary more than they were due. How can this happen, right? If someone doesn't report Social Security, doesn't know if they're working, then they might get too much of their Social Security benefits, and the Social Security Administration is going to say, hey, you got too much, you need to pay that back. During the pandemic, it was a lot of that happened because there was nobody really operating the reporting wages during that time, and so there was many overpayments that people got after that. If you're reporting wages on time and you're keeping consistent communication with the Social Security Administration, it reduces the likelihood of those overpayments happening. So what happens if someone gets an overpayment? They have options. There's 3 specific options that can help them. So the first one is an appeal. If they feel that this is incorrect and they are not responsible for this overpayment, they can appeal that. They have to within 60 days of getting that overpayment notice. If they feel like they were not at fault and they're not able to pay back that overpayment, then that's going to be when they're going to want to do a waiver so they can have that overpayment completely waived. And then the last option is maybe they do feel like it's their responsibility and they want to start paying that back. Then there are repayment options for that individual to help reduce that overpayment until it's paid off. During the shutdown, I want to also remember, or a reminder here, that they're not processing these right now. So if there are individuals that are having issues, we're going to have to wait until the government reopens. Okay, we wanted to highlight some of the things that we've heard as benefits planners or work incentive specialists. And you may have heard some of these things as well. But the big one that I feel like, as a job coach, for the time I was a job coach, about 10 years, and now as a benefits planner, I hear this way too much, is that I was told I can't work more than 20 hours. The reason that this is false is because the number of hours is only a piece of the puzzle, right? What if someone makes $50 an hour versus someone making $10 an hour, which that's below minimum wage, so we should probably say $15 an hour. That's a big difference based on those hours, right? And so if an individual goes off of hours and not off of the total income for that month, they're not getting the right calculation. So it's really important to not share things like don't work more than 20 hours, because an individual, based on their hourly wage, that could be really hard for them to have the right information, essentially. I can't work at all while receiving SSI or SSDI. Well, we just proved that that was not true, right? Individuals can work and have their benefits as well, whether that's a small SSI payment and a lot of earned income. It can be a lot of different, ways that an individual can work. So I think that it's important for not to share something that's not necessarily true, right? I can't save or I'm going to lose my benefits. There was a program we talked about last week called the ABLE account, and that ABLE account is actually a way for individuals to be able to save over that $2,000 limit. So that is also false. Aren't SSI and SSDI the same thing? Well, like I think I said in the beginning, Social Security often refers to them as the same thing. They say Social Security benefits, and it could be either of those. So often it's a misunderstanding that they are the same, when in reality they're very different programs with very different work incentives as well. And the last one, it must be SSI if they're a youth. Well, we just learned that there's childhood disability benefits. And so they could be getting benefits from someone else's work record. And so we wanted to prove that that one's not true as well. Michelle, I think you had a couple others. Did you want to share any of those? Or are we feel good about these?
That was good to cover. I'm sorry, I needed to unmute myself.
That's no worries. Great. I know that we had talked about a lot of them, but I think these were like the highlighted ones.
Definitely the highlighted ones.
Open to hearing more from the audience too during our question and answer. If you feel like you've heard something and you're curious if it's true or false, we'd be happy to talk about some of those too.
Yep.
And here we are, Q&A. If you were here last week, we discussed making sure to leave a good amount of time to have this be an engaging conversation. I believe we use either the Q&A or the chat, and we're here to answer any questions. I think we do have a couple that were prepared as well, and so I can bring those up and we can talk about the questions that were submitted prior to today's call.
Those are all in the Q&A. And if you have a question you'd like to ask, if you raise your hand, then I can unmute you so that you can ask it verbally, or you can add it to the chat.
Okay. So the first Q&A I see here is, how can we counsel the VR participants about when they asked about WIPA services and what it entails? All right. Well, I'll tell you from my perspective as a previous job coach, now benefits planner, and also a beneficiary. I think that whenever anybody goes to work, it's incredibly important for them to be able to make an informed choice about what they want to do with their employment. And in order to do that, the information and informed choice is super important, right? So if you don't have the information, it's really difficult sometimes to make decisions about what you want to do for employment. So I would let the individual know that benefits counseling, and I like using benefits counseling better than WIPA because I think it's more understandable. WIPA is an acronym that not everybody and actually across the United States uses the same one. It's all different. Sometimes it's WISA, sometimes it's benefits planning. So benefits counseling makes more sense, and the individual to get a good understanding of how work and benefits, how the benefits could be impacted by earnings. And in the simplest form, I think that's the best way to understand that.
And usually what I say is, it is when I call up somebody, I said, I'm the person that helps people understand how work and benefits go together. And it's great information for you and for your family as you're making more informed choices about your working and what you're looking to do in the future. So yeah, so I usually just kind of bring it to that basic level. It's just, again, knowledge is power. I think that's the key to anything. And the more you know about it, the more you can maneuver in the best way possible for your life.
Mm-hmm. And a couple other things that you can do is normalize their concerns, because they're going to have some. They've said that in both of these presentations that they're going to have concerns about working and losing their benefits. And so you can reassure them that your benefits counseling or them going to a benefits counselor is going to help them steer clear of potentially losing their benefits and keep them in that safety zone. And then you want to make sure you follow up with them after they've seen a benefits counselor to make sure that they understand what was said, and then see if they have any questions. And if you need to make other referrals, do those things as well.
Absolutely.
Want me to do the next question, or you want to do it?
I have one more thing I wanted to mention as far as what this entails. And so I've provided benefits counseling in person and virtually, but mostly virtually. And what it entails is an intake where the benefits counselor and the individual are going to meet and talk about everything that that person already knows about their benefits. And then the benefits planner is going to reach out to Social Security to verify the information and make sure we have the most updated information from the Social Security information. We have that. That's our opportunity to analyze that information and make a benefit summary and analysis to provide to the individual. And then once that's completed, we meet with them again to go over all of that information. So from start to finish, I'll maybe let Michelle and Bob talk about the timelines. For me, it's usually, I would say, 4 to 6 weeks, making sure that we can meet with that individual, go over the information, get the information from Social Security, and then provide that review with them.
I think that's great, Maddie. Yeah, I think the virtual option has really helped individuals because they don't have to go anywhere. And we can get on the phone and we can actually go face to face on the phone. And it allows them the opportunity to get it done right then and there. Gather that information, again, with Social Security being open, having a good contact to get the right information, and then generate that report. It's anywhere between what Maddie was saying, 3 to 6 weeks, depending on how fast you can get the information. And they like that, and they get a copy of it, and we get back on the phone and we go through it together. And I still have customers calling me, hey, I'm getting that full-time job now, so let's talk about it. So, and I will pull up their report, and they know what they're getting themselves into. I want to go full-time, and we go through those protections again with SSDI, and he's ready to go. And actually, he's very happy working full-time and knew what he was getting himself into. So it was a good connection, and they always have me to talk to them later as well.
Well, and a lot of us too will tell our clients, if they get a job offer, whether it's part-time, full-time, doesn't matter, and we will go over what that specific job will do to their benefits. Once they have an offer that's concrete that says, you're going to work this many hours at this rate of pay, you can tell them exactly. So it takes a lot of the fear of the unknown away.
Absolutely. The next question is, how does Ticket to Work bridge the gap between vocational rehab and SSA, the Social Security Administration? Michelle, did you want to touch base on this one? I think you mentioned earlier, I think you had a great example of that.
Also, Bob, because he's been involved with it too. So
great. Yeah,
yeah, so Ticket to Work, being that I do work for a vocational program, I am an employment network as a VR, all state VR, so they can take your ticket. Ticket to Work is you go to any employment network and say, hey, I want to use this, and the idea is maybe working on the benefits. When you're working, I'll specifically talk about the vocational program, the state vocational program. You are assigning that ticket to them. The moment you sign your employment plan, the moment you do that, that ticket is assigned to that VR program, and their responsibility is to help you move and navigate through the process of becoming employed. There's all kinds of different things that come along with it. We can get into the weeds with that. There's Partnership Plus, there's the transfer of your ticket after the vocational program is done. You guys have been successful, so eventually it can move on to somebody else that continue to follow through. So there's various stages with this as well. Bob, did you want to talk more about that?
Well, one of the big things with Ticket to Work is it kind of pauses medical reviews while you have an open ticket, while you're still working through the VR process and getting a job. And so you don't necessarily have to worry about, going to doctors and making sure all that is done. It's just, it kind of pauses everything to let you focus on getting employed, staying employed, and going through that process. So it's kind of a one at a time thing.
Both for sharing that. And I because I'm a newer benefits planner, I'm still have a bit of a learning curve with Ticket to Work. But from my understanding, making sure that the individual, if they're going to assign their ticket after they are completed with vocational rehabilitation, the intention is that they are going to work off of those benefits. And so for sometimes individuals, the intention is not to work off their benefits, but for those individuals that maybe are intending to do, the ticket program can be great for them. The other question I see here is, and it's more just a comment, is ways for encouragement to work. And it's, as far as it's related to Social Security and work, I think that encouraging an individual, the best thing to do is to help reduce, I know it's not possible to eliminate, if an individual is afraid of losing their benefits, or even more so for myself, losing my health care, I can see why someone could be very nervous or not want to work more or work off of benefits. So encouragement to me is helping reduce fears, or maybe even just helping provide exact scenarios or different situations for someone to choose what work situation is best for them.
And that's where hooking up with a good benefits counselor, benefits planner can be beneficial for that person, because they have someone to reach out to and bounce things off of and say, hey, I'm unsure about this. Can you help me? And that's what we're here for. So, it helps people to move away from the fear and move into, yes, I can do this, and be a little bit more confident in their actions.
About that a lot too, is in our actual counseling, we're talking about those scenarios. We're talking about those work protections. We're talking about what makes sense. We're listening to the individual. It's so individualized, and we want to make sure that the information that's being provided is useful, and giving that advice that, yeah, now is the time to do this, or hey, try this first, and with I've been with VR for 25 years, I have that counseling background too for rehabilitation, and it's like, we need to talk about that. You've been out of work for so many years. Do you want to jump in right away, or do you want to try little bits here and there first to get it going? And by the way, you're going to be making more money, and you still get to keep your benefits, and you still get to keep your health insurance. Going back to work can be scary, especially if somebody has been injured and has been out of work for a long time. Going through that process together and saying, you have an opportunity to try something, try it. You have this trial work, or hey, try it. You're not going to be above a certain SGA. Try something. And just the words of encouragement helps.
Absolutely. I think it's also important to mention that in the benefit summary analysis that we create, the scenarios are not generic scenarios. The reason a lot of these reports take time is because the individual and making short-term and long-term plans for them. And so it's not a template that we just cookie cutter put into this report. It really is, like Michelle said, individualized to each person, because everybody is so different, and where their work history and where they want to go with work is so different as well.
And you also want to make sure that you give them exposure to different work environments, because if the first time they hear about work is at age 25, and you want them to see a benefits counselor, and they're like, what? The only jobs they've seen is yours. The one they don't want to do. You know what I'm saying? So you have to expose them to different work environments, and also tailor skill development to the basic skills that are necessary in any job.
Absolutely. Did I miss any questions?
Just how do you find a job for someone who wants to do who wants to work in the night? It's also vocational rehabilitation, and now has SEC through the waiver, and still has no luck other options. You want me to answer that one?
I'll tell you, the first thing I would do is find a So someone that is doing the job that you're looking to do and say, hey, can we go to lunch? Can we get coffee? Can we just have a conversation? Not asking for a job. What are you looking for? Where am I falling short? And how can I improve? And how can I get to where I want to be? So whether that be through VR or, like I said, somebody that has the job that you're looking for, and play to their ego a little bit. You're great at your job. How do I get to where you are? And let them help you, and let other people open doors. Sometimes it's not what you know, it's who you know.
Mm-hmm. And if their abilities are not if their abilities are such that they require more assistance, then you can talk to the vocational rehab counselor about customized employment or the discovery process, because that's more in depth and it's a slower process. And that tends to work for those who have more significant needs. And Voc
Thank
Rehab
you.
pays for it.
It is a service that vocational rehabilitation provides. Yep. Okay. We do have a new question. I'll go ahead and read it out loud. It says, I have a child that recently turned 18 years old. He is autistic, does not receive any SSI benefits, has been on the waiver wait list for many years. How can I get him signed up for VR? And now that he is 18, still living at home, would income still affect his applying for disability benefits?
So as far as applying for VR, just go ahead and usually if he can advocate for himself, calling that local office and making that referral, that's a good start. As far as income in the home and some sort of benefits, they do not take that into consideration because he's over the age of 18 now.
Mm-hmm.
Was that all the question there, Maddie? I'm not seeing it.
Yeah, and now since he is on the wait list, I'm going to give you the information for another program that you want to apply for, and everything that you're waiting for through APD, you can also get through this waiver since they're on the wait list.
I'm also going to add the link to the VR application to the chat. So if
I
anybody,
haven't.
oh, I just put the link in there.
Oh, I put it in the Q&A. You did the
Oh.
chat.
Sorry.
You're fine.
You can find it in either now.
Yep.
Must say you're fully covered.
All right, we got about 5 minutes left. Let me see if there's any more questions in the Q&A. I don't see anything new. All right. Oh, I see a new question. Yes, if they are in pre-enrollment, they can now do the ICMC program in Florida. More of a comment.
Yeah, that's the link I'm looking for, so I can put it in here.
Okay. On the screen now are some of the resources that we find incredibly important related to Social Security benefits and work incentives. The first one is the ABLE National Resource Center. We also have the link to the Social Security Administration, which is Denise shared last week. Very straightforward, ssa.gov. We also have a link to the Red Book where you can find all the rules related to Social Security. We included Cornell University's link to their support center for work incentives, as well as the Virginia Commonwealth University. And we also put the Ticket to Work helpline because we had a few questions about that as well. A lot of the information, if not most, came from these resources. All right. That is all from our presentation.
Thank you very, very much.
Of course.
So if you look in the Q&A, the answers are there for all of these, as well as the links that we've talked about. And then I just have a few more things to go over with you all. So the video that I thought I was showing you earlier, I'm going to show that now, and then we'll go through to the survey. And it has no sound, so don't worry. Happy Friday. So today we just completed Social Security Part 2, and I want to thank our speakers for their assistance. And if you need to reach me, I will put my email address in the chat. I am the FCIC Employment Coordinator. And the link to the survey I will put into the chat, or you can scan this QR code. It is your choice which one that you want to do. Sorry. Once you complete the survey, you should get a pop-up that lets you know that your certificate link should be acknowledged, and you should also get a letter. That's the way it's supposed to be. I know our system was down last week, so I ended up sending them out to all of you. Just going through the chat to see if I missed anything. Someone said something about able, and I don't see it now.
It was in regards to presentation, I think.
Yeah, as John asked if who to reach out to if he wants to have us present, and I said myself or Denise.
Okay, thank you.
Mhm.
Thank you, thank you, thank you. And the handouts were also put in there. You'll get an email from me, everyone who attended today, with the handout and the survey link again as well. If you didn't happen to get it from here. And then those who did the survey, you'll get some information from me again after you do the survey and get a thank you letter. So thank you for joining us. Our next webinar is going to be on November 14th. It will be at 3 p.m. It's a little bit later in the day, and it's on hiring practices for neurodivergent individuals and inclusive workplaces. And so we hope that you can join us for that. If you want to see today's webinar, or you want to share it with someone, give it about 36 hours. And I'll have it published at the same link that you registered at. The one from last week is still there at the same link you used to get in. You can go in and view that, and they'll be available until January. And then the one on self-employment is also published and available for people to view. The only thing is you don't get the handout immediately. You can just email me and I'll get those to you. And then once they come off of there, they'll go onto the FCIC website and be archived there, and also on YouTube as well. So thank you all for joining us today. I will give you back 30 seconds to your lunch hour. And I look forward to you joining us again in the future. Have a great weekend, everyone.
Happy
Bye-bye.
Friday.
Happy Friday.
Bye, everyone.
Please visit our website for more information about our programs, projects, and how you can get involved.